fixing backs and dropping facts.
That's right, son. You're so good, man. You're so good.
Too easy, man.
I know,
Too
right?
easy. Hey, how you doing? My name is Kai Blake.
I'm Tom Larson.
And we are the boys
of
Bass coming at you like Kamikaze, fixing backs and dropping facts. Man, what episode we on, Tommy?
Son, we're on 21.
21.
Yeah. You go Kai Blake 21?
21. Yeah, that's me, man.
I know,
That's
right?
the Gmail. Gmail.com. Kai Blake 21.
Don't tell
Gmail.
everyone that.
Fly Guy Kai 21. Yeah. Right. Fly Guy Kai 21 on Instagram. Yeah, man. All right, what we talking about, Tommy?
Well, we're talking about Arthur.
Arthur. Oh, that Arthur.
You get patients in all the time saying, man, I got all this arthritis. I got pain all over. I got arthritis.
Every day. Every day.
It's a simple scapegoat.
For all pain, knees, ankles, shoulders, knees, everything. Arthritis is affecting me, causing it.
I had one in the office the other day, 16 years old. I got arthritis in my knee. I'm like, wait, you're 16.
Ain't no way. But hey, it's the way when doctors can't explain why they're having the pain of the joint. It's arthritis.
Yeah, I kind of think it's a catch-all umbrella term sometimes.
Yeah.
Sometimes I feel like physicians will tell you got arthritis when you have degenerative disc disease, which I guess is a degenerative change, which could be considered arthritis, I suppose.
Technically, yeah.
But I'm thinking arthritis like bone joint wear.
Right. Yeah.
So what you'll see on an arthritic joint, typically a healthy joint looks like a chicken bone. The chicken leg, you pop it off, and it's like that white, nice smooth cartilage, right?
Yeah.
Well, an arthritic joint looks like the surface of the moon, kind of like
cratery,
dark spots, things like that. And those are arthritic changes that happen in the joint.
And unfortunately, it's a structure change, right? It's a structure behavior of that joint and it not basically working properly. You're not getting the same synovial fluid. It's a little more creaky and a little more pain, inflammation, all that kind of stuff. And your body doesn't work well with that.
There can be lots of things that contribute to why you get arthritic changes in the first place. It could be a traumatic injury, like you fall out of a tree and you break your leg or something like that. That can be contribute to arthritic changes. But typically, I'm thinking more like mechanical issues. Alignment issue. Think about like alignment on your car tire. It doesn't matter how strong your tire is. If your alignment's off, it's going to wear it out prematurely. Same thing with a joint. So when we have alignment issues, it goes back to neuromuscular patterning. How are the muscles controlling that joint? Is it good? Is it bad? Is it off? What's happening there? And that's what we should be treating.
Right. And so we treat the dysfunction, not the pain. So we can't do. Let's say this, not to say we can't do anything about your arthritis.
We don't treat that.
We can't do it. If it's there, it's there. We can't do anything about it. But we can treat the dysfunction that might be led to the arthritis. Right.
Now you're speaking my language. And the thing is, the reality is, you can have all sorts of arthritis and not have pain. I had a person that had a total knee replacement. And they needed both done, right? And I said, well, why did you do the left one first? I can't remember what was left.
Yeah.
Well, on the image, that one was the most arthritic. Okay. Well, which one hurt worse? Well, the right one hurt worse. Wait a second. You had more arthritis on the X-ray on the left. You had less arthritis on the right. But more pain on the right. So you chose to do the right first.
Right. Well, no, do the left first because it would have showed. Because it would have showed.
It showed more.
Because it would have showed more. Yeah.
Right. So now we're treating the image.
And not the pain. Yeah. And so you want to make sure definitely because it's like if you're walking on pain, now you're gonna have one leg that's definitely gonna hurt more because you just got surgery on it, and then the one that was in more pain, it might seem less now because you got the surgery on the one that hurts more. But now you're treating. Now they just had two hurt knees as opposed to getting that one out that was hurting.
And there's so many things out there that don't show up on the image that can cause those changes, and we really need to be addressing those.
Yeah, so it's just like a lot of times, like you see, I know when Tom does his evals, you're looking at the alignment, the standing posture of the person, how they're standing, because you'll see it a lot of times, even how they walk. You'll see how the weight distribution is off. And so you think, just like you said, in the alignment of a car, if you're riding and your axle's a little bit tilted, there's going to be a tread of tire that's going to be worn out. Or look at the bottom of your shoes in the back. If you have the leather shoes, you look at the bottom of that heel, you'll notice it'll be a size that's going to be and everybody's different. It's not just because that's how the shoe and that's where it gives out faster. But if you look at the bottom of the shoe, you'll see there's some parts of the shoe that's going to be a lot more worn, maybe if on one side more than the other. So you'll find the lateral side of one shoe is like, oh man, that's starting to, there's no tread on that one, but on the other side is the medial part. So you've been walking for this whole time. So just think of that. That's how it's reflected in your joints. Your joints are just taking that same ground on that one part over and over until it's just like, hey, I'm giving in. I can't do anything more.
So, I think the reality is that when you do have arthritis, that's kind of normal part of aging, wrinkles on the inside. It happens with, as we age, or there could be a traumatic injury like we talked about.
Right.
But the reality is, man, we really need to treat the things that would contribute to why you're having that first place.
Right.
Do things that help support the joint so it's not compounding on that arthritic change. But there's all sorts of good research out there that you have arthritis and not have any pain.
It doesn't have to be. Not everything that you get diagnosed with has to be symptomatic. You can have it, and it doesn't. That's not the contribution. It's easy to, and sometimes it gives refuge to the brain. So your mind is like, man, it makes me feel better to know that this is what it is, and it's not like some terminal crazy thing that's going on. And I get that it makes you feel better, but don't think that, hey, this can be this. There's ways that we can't fix the actual structure change, but we can fix the muscles around that are contributing to that change that's kind of developed.
So I guess maybe the takeaway from this episode is that if you go to your physical therapist and they say, "Oh, we're going to treat your arthritis," run.
Right.
Liars! If your knee hurts, just run, hobble out of there.
Imposter. It doesn't work. It's not going to work. It's not going to work. No, you got to fix. They got to fix the stuff around it, man. Strengthening, mobility, all the same stuff we go through every episode, man. Just the process, the mobility, the strength, the neuromuscular education, changing all that, getting that running more proper. You're going to set up for a better future.
Yep.
Yeah.
So I guess until next time, go out, live, work, and play better inside your body. Peace out.
Peace.